Welcome to Empowered Health. Michelle, it's fascinating to see how many interesting topics we go through every week on the show. I feel I'm getting healthier by the day.
Me too. Today will be no exception. We have wonderful stories for you on chiropractic health, eye health, and sleep.
And don't forget, I'll be jumping into the kitchen with Chef Julia Olson as well to try out a new healthy, delicious chard recipe.
But first, we have another inspiring story of integrated health in action.
In my lower back, I've got streaks of pain that's pretty well constant. In my neck, I got 3 discs that are compressed, and I get a lot of pains down my arm, down my leg. When I go for walks, I can barely walk block and a half without pain coming down my legs. I'm pretty well in constant pain.
A lifetime of hard-hitting sports has left Derek Dempster in excruciating pain, the sort of pain that has numbed the better part of a decade.
We've seen a lot of doctors, and then I haven't had the success that I expected, and Don seems to have pulled me through in a lot of times where nobody else could.
Dr. Don Nixdorf is Derek's chiropractor, whom he sees regularly. Dr. Nixdorf has introduced a variety of alternative approaches to his pain management in addition to chiropractic treatment.
The chiropractic approach to healthcare has been around in British Columbia since 1934. So that has been included constantly as people's normal healthcare. But what we're finding in research and technology is new technologies that help treat as well as examine patients faster and more effectively.
One of these new techniques is something called Ferroblock. You can see Derek wearing it here as a blanket.
It totally relaxes me. It makes me feel warm. The circulation of my blood in my whole body I can really recognize that situation in it. And I feel well rested when I get up in the morning, and I feel like I can go.
Ferroblock fabric shields the body from high-frequency electromagnetic fields, which can cause irritation to nerve endings and cause pain.
We found that the proprietor, the inventor of the fabric, has discovered a remarkable thing that you can actually demonstrate that there is EMF, you eliminate the EMF, and chronic pain response. Now, in the chiropractic profession, where we're dealing with functional problems all the time, even for conditions that nobody is helping, finding something that is producing faster recovery, in some cases recovery that wasn't occurring, that's a huge benefit to our patients.
I pack it everywhere I go, and it's worked. So it's something that I'm a firm believer in.
Coming up on Empowered Health.
Is fresh best when it comes to fruits and vegetables? It depends on how you define fresh.
You're watching Empowered Health. Coming up, the chiropractors are back, pardon the pun, with some cutting-edge research on the spine.
But before we get to that, Randy Shore is here with some no-holds-barred information to consider when it comes to our health. Randy?
Is fresh best when it comes to fruits and vegetables? It depends on how you define fresh. A lot of people believe that fresh, uncooked fruits and vegetables are better for you than the frozen or canned product. A lot of people are wrong. Let's take a step back and unravel this question. If fresh means vegetables that are grown in New Zealand, Chile, or California, picked, wrapped, shipped, and sold in a supermarket 1 or 2 weeks later, you may not be getting what you think you're paying for. It's easy to do nutritional analysis of vegetables hours or weeks after they're picked, or months after they're frozen or canned. And when you go looking for antioxidant and vitamin content, those imported, quote, fresh foods don't always measure up. In many cases, the frozen and canned product has more of what you're looking for. Broccoli is a nutritional star loaded with vitamin A and C and cancer-fighting antioxidants. And it stays that way for a few hours. But after it's picked, the vitamin and antioxidant content starts to drop right away. After 3 days stored at room temperature, nearly half the antioxidants are gone. Vitamin C and protein content also decline. Fresh lettuce loses much of its antioxidant capacity within 3 days of being picked, even when refrigerated. Ditto for lima beans and spinach. The exceptions are bell peppers and tomatoes. When picked green, they increase their vitamin A, though their vitamin C does drop. We aren't talking about a few percentage points here. In many cases, 40 to 90% of the vitamin content is lost during the time it typically takes imported produce to make it from the field to your table. Food companies invest a lot in the cold chain to ensure that food is kept cool and nutritionally stable from farm to fork. But the trip those vegetables make might be thousands of kilometers or even halfway around the world. Canned and frozen fruits and vegetables are usually processed within hours of being picked, and both methods of preservation can halt or dramatically slow the decay of nutrients. Canning requires heat processing, which causes an immediate drop in some nutrient content, but after that, they're quite stable for months. Canned and frozen foods are picked at the peak of ripeness, when nutrients are at their highest levels. But you can do even better. For maximum vitality and nutritional content, locally grown vegetables and fruits, picked ripe, are the best. Some supermarkets carry a few locally grown foods, but you should always ask for more. Farmers market vegetables are usually picked the day before or the morning of the market, and that's ideal. The only better vegetables are the ones growing in your garden, picked and eaten at the height of their nutritional potency, and they taste better too. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Jean-Sébastien Blouin, who is going to talk to us about standing balance.
So we're studying standing balance, so how people maintain standing balance. And the main purpose of this apparatus is to understand how we can reorient ourselves when we stand. So let's say you're looking to the left or looking to the right, you still have to have a sense of where your feet are with respect to your head, and that's what we're trying to study here.
The device you see here is one of the tools Dr. Blouin is using to analyze automatic movements of the body.
So the device here, we have two motors that can rotate independently, either the head or the whole body, so we can manipulate without the subject knowing where their head is with respect to their feet. Then we can try to look into the mechanism that allow us to, shape this perception of standing.
It's all about integrating and understanding human function and mobility.
So once we understand how, things are integrated into a normal individual, if I may call it that way, someone with no pathology, then you'll have tools to be able to evaluate in function in people that have balance deficits. And then what you can think about, like maybe longer term, would be like to try to develop new rehabilitation therapies.
This not only applies to people who may have balance issues, including seniors and falls, but can contribute to a better overall understanding of the spine.
To know where your head is with respect to your body, you need information from your neck muscle, the neck joints, and then that's where I think the chiropractic side comes in the whole picture. Like if we can understand neck function, then we'll be able to apply that knowledge towards chiropractic.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Today we're going to show you how to perform a metabolic resistance circuit. A metabolic resistance circuit involves performing an exercise one after another with no rest in between in a circuit fashion. This kind of workout is great for people that don't have much time, want to improve their cardiovascular, as well as lose body fat. You can perform each exercise for 10 to 15 reps with just body weight if you're a complete beginner. When designing your circuit, it's important to train the biggest muscle groups first. These circuits can be performed 2 to 6 times with about a minute to 3 minutes in between, depending on the weight used. Now, if your main goal is to build muscle and get strong, this may not be the best option for you. All right, try these circuits out, and we'll see you later.
After the break.
As soon as somebody is struggling with their vision, they begin to reposition the body. A $1,000 chair can become absolutely zero value really quickly if you're not seeing well.
Welcome back to Empowered Health. We're going to check in with the sleep shop to learn about the latest in sleep apparatuses.
But before that, let's find out the connection between, and I'm not kidding about this, an ergonomic chair and our eyes. Take a look.
Ergonomics is an amazing process, and when you're in the right position, exactly the right position, not just for your body but for your actual visual fields, you can get great results.
Ergonomics is the science of matching a work function and the employee to the right products and workspace designed for that job. That means the right chair, desk, computer screen, and its placement, along with a whole whack of other considerations that factor into worker safety and productivity. But consider this: what happens to your great ergonomic design if you have eyesight challenges?
Well, actually, the entire value of the ergonomics is gone, because as soon as somebody is struggling with their vision, they begin to reposition the body. You'll tilt your head, use your neck to extend or drop the chin. Your shoulders now come into play, and then your spine's out of alignment. So a $1,000 chair can become absolutely zero value really quickly if you're not seeing well.
When it comes to seeing well in the workplace, as the day goes on, you inevitably start to get tired, especially if you're staring at a computer all day.
Even as you get tired throughout the day, you change what your positioning is. And so that's why it's really important to have those quality visual aids like your glasses and contact lenses so that you're seeing really well, because as you tire, the same thing will happen. You just won't focus as well. So once you start to lose your focus ability, you're going to slouch, you're going to be down.
And there it is, the direct connection between your eyes and your ability to work productively, effectively, and efficiently.
I think it's really important for an employer to understand the value of good, healthy eyes and good vision in a workplace. And oftentimes people don't see that as being a responsibility of the employer. Now, many employers do provide eye care benefits, but if you're going to really identify best quality eyewear, and for people, especially people who are in front of computers, spending a lot of time focusing on numbers, on detailed items, people that are out in the workplace outside, so they're driving, their vision is so important. And vision being what it is, fractions of improvement make massive difference.
That's also why it's important to see your optometrist for regular eye exams and make sure you're wearing the correct eyewear.
Really, it's as much an importance as the work environment, the chair you sit in, the materials, even the training that you provide to an individual. Having good vision is going to make a difference to their productivity and the quality of their work.
I'm joined now by the bed expert, Farooq Manji, and today we're going to talk about those extra things that can help ensure that you get a good night's sleep. Apparatus. What are some of the apparatus? I know that we've got wedges for sure, but what else are there?
So wedges are good. They're elevation wedges that can help you get yourself propped up to give you the proper, consistent type of support. A lot of people will cram a bunch of pillows behind them and try to prop themselves up. The other important one is a knee bolster. It's a piece of foam, essentially, that's designed to go under your knees to let your legs and knees be raised to a position where it can alleviate the pressure off the lower back and give you that proper support. You can use it in bed, you can use it whilst you're watching TV, you can use it if you're just laying on the ground, just to give you that extra support.
So would that bolster also help pregnant women? Because sometimes they need to lie on their side and get a little separation between their knees just to help their hips. Does the bolster help, or is there something else that they should consider?
That's a really good question. So the bolster is a separate one. There are cushion wedges that we have, and they can be made of a variety of different foam products, but essentially that, to place between the knees. It's a really good piece for not only pregnant women, but side sleepers, people who tend to sleep on their side. And when you get your two knees that are connected together, it tends to hurt, so you kind of separate it and then you'll tilt your lower back, but having that there will cushion that.
When it comes to this kind of apparatus, are these specialty items and you want to have them custom fitted?
They pretty much have it down to a science now. So there are knee bolsters and elevation wedges that are designed for various heights of individuals. And we have those. We have choices that you can go from a 20 to 15 to 30 inch height on the wedge. And the knee bolster, we also have a variety of different heights. So taller people obviously will have larger wedges, shorter people will have smaller wedges, and it'll depend on the need as well. So if it's a breathing issue or is it something that's acid reflux or things like that, will also depend. So you don't want to be too elevated, but at the same time you want to have the right elevation.
One thing that I'm wondering, if you've got a memory foam bed and because it sort of conforms to you and you put a wedge in now, do you need to be aware of how that's going to conform to your bed and to your body?
No, absolutely. The wedges, they're of a large enough surface area that it can work on any type of mattress. So if it's a memory foam or a spring mattress, it'll work fine.
The point is that you want to get the best sleep for you and for your well-being.
Absolutely.
Well, thank you very much. This has been incredibly valuable information. And of course, we all know how important sleep is for each of us.
Yes.
Thank you. Thank you. Coming up on Empowered Health.
We are making Swiss chard with pesto and pine nuts.
This cooking and nutrition portion brought to you by Save On Foods.
Registered holistic nutritionist Julia Olton is on the show with another amazing recipe to make a salad. Julia, welcome to Empowered Health.
Thank you.
What are we making exactly?
We are making Swiss chard with pesto and pine nuts. So one of the things I wanted to talk about first was that when you take the green off the actual leaf, you could actually do that.
Okay.
I like to save the ribs because if you cut the ribs in, you chop it up like onions. I've already done a bit of it here.
Right.
You can saute them and they have a very, very subtle oniony kind of flavor to them.
So these can be, I always throw them away.
No, we're going to saute them. You're going to see how delicious they can be because they add to the recipe. So all you need to do, the chard, we're going to just slice into, bite-sized pieces.
Okay.
I'm going to take the ribs that we've already chopped up. They're just little, like an onion.
Right.
And some garlic.
Okay.
And we're going to go over to the stove and just saute them. And get them soft and cooking. So this will take, I don't know, about 4 minutes at a medium heat to saute these. And we're basically doing what we normally do, which is sweating the vegetable and just getting it broken down and soft. So we're going to let that cook for probably 4 minutes, keep our eye on it. And then
in the
meantime, I've made some pesto. Pesto is really, really simple. It's olive oil, pine nuts, Parmesan cheese. We use Romano, but it can be Parmesan, some garlic, and then basil.
All mixed
lots
together.
and lots of basil. And you just put it in the blender and you spin it.
Okay.
And it turns into
this paste.
And you can throw it in vegetable dishes. You can throw it in pasta sauces.
Right, exactly.
Any kind of stir fry. Then we've got roasted pine nuts. I toasted those before we came today, so that those are ready to go. And then the raisins are going to add just a little bit of sweetness to our dish. I hear this.
Yeah.
So the chard itself is going to take about 10 minutes to cook. So if you're planning a dinner and you want to make sure that you've accounted for the fact that this is going to take a little longer than most vegetables,
right?
You need to plan on at least 10 minutes for it.
10 minutes is not that bad.
No.
I mean, yeah.
And
then all of this will be mixed into that.
what we're going to do is we're going to put the chard and the raisins and a little bit of water in with the stems.
Okay.
And we're going to cook them for 10 minutes. And then at the very end, we're going to add the pesto and the basil nuts.
And the nuts.
Yeah.
All right.
And then we're going to let it cook covered
For 10 minutes.
6 to 10 minutes.
6 to 10, okay.
You're just going to have to look under the lid and just have a peek and see what you think.
So just a quick recap. We put some oil in. What type of oil did we put in?
We put coconut oil in there to saute the ribs,
Right. Okay.
or the onion.
And then we just put the sliced chard.
Chard and some garlic.
Right.
And then you add the chard and a little bit of water. I did about 3 tablespoons of water, and the raisins. And then we're just going to let it cook for 6 to 10 minutes, and then
Alright.
we're going to add our pesto and our pine nuts, and voila.
So Julia, the salad is ready.
It is.
Time to try it. And the pesto smells so good.
I want to see what you think.
It is really, really, really amazing. And especially the stem of the chard.
Yeah, it
Gives it-
adds a really nice subtle bit of flavor, doesn't it?
And
Yeah.
thank you for being on the show for yet another amazing recipe.
Thank you for having me.
Thanks a lot. Registered dietitian Melissa LeBlanc's here to talk to us about dog greens. Let's get right into it. Melissa, welcome to the show.
Thank you, Vijay.
So dog greens come in a wide variety, right?
That's right, and I'm hoping to introduce you to a few new ones today as well.
I'm looking forward to that. So to start off, Melissa, tell us, why are dog green veggies good for us?
Well, these vegetables are packed with nutrients, so they're a great source of folate, which is a B vitamin that's involved in making red and white blood cells. They're also a great source of vitamin C and potassium, which not too many people are getting enough of. You can also find the antioxidant lutein, which is really good to keep our eyes healthy.
That's fantastic. And these could be enjoyed cooked or raw, right?
That's right. So, and in fact, when you're enjoying them cooked, you're concentrating some of those nutrients.
And what's the best way to flavor dog greens?
Well, a dark green vegetable like kale is one of my favorite vegetables, and I enjoy sauteing it in a little bit of olive oil with some garlic, a pinch of chili flakes to add some heat, or a squeeze of lemon juice to brighten their flavor. If you want to take it a step further, you can also add a dash of sesame oil, or instead of salt, try adding capers or anchovies.
Let's talk about some of the variety that we got right here. Is this kale?
It is kale. It's a different variety of kale, the type that you're used to seeing. This one is called dinosaur kale.
A dinosaur kale.
Yes.
That's an interesting name. These tiny little leaves, I've been seeing a lot of these off late. What are these called?
So this is arugula, and it's gained quite a bit of popularity in the last few years. It has a peppery flavor, so it's great when you make a salad with it, but you can also stir it into a cooked dish, like a pasta dish.
Okay, moving from arugula to this, looks like broccoli. Is it broccoli?
It's broccolini. So,
Broccolini.
Yes, and it's a bitter green, but don't let the name scare you. Once you cook it, the flavor is very mild and delicious.
Well, Melissa, thanks for being on the show and telling us about dark green veggies.
You're very welcome.
Well, that's it for this episode of Empowered Health. As always, I learned a lot, Michelle. But one of the things that I learned during today's segments was that I need to integrate more chard in my diet.
Stay tuned next week for more information. In the meantime, you can follow us for news and updates on Twitter. Thanks so much for watching.
We'll see you again. Bye.